Hand and Upper Limb Center is a major surgical innovation, not only in Canada, but around the world. And we have both Drs. Roth and McFarlane to thank for that. When they got together and came up with this concept, there wasn't anything like this in Canada. And they were able to solidify that concept here at St. Joe's, and the rest is history.
The vision behind the Hand and Upper Limb Center that Jim and Bob had was to develop a combined unit for the care of patients that had upper limb conditions and injuries, and provide excellence in clinical care, teaching, and research with a team approach to achieve that goal.
What time has demonstrated is that there was actually a huge unmet need. Our numbers have grown phenomenally since those first few years.
Dr. Roth and McFarlane had a vision to create something really exceptional here at St. Joseph's Healthcare. They brought plastic and orthopedic surgery together to create the largest centre of its kind here in Canada. It is internationally renowned for its care and its innovation in hand and upper limbs.
The concept that change is opportunity was always something Jim would say. He always wanted to move forward, to make things better. And of course, the only way you can do that is to change. With respect to surgical innovation, I think our mentors or pioneers, of course, were also innovators. Jim Roth was the developer and founder of wrist arthroscopy, which is now used throughout the world, and Bob McFarlane was a world leader in the treatment of Dupuytren's contracture, scarring disorder of the hand. So the idea of innovating in surgery has always been a part of the center.
At Roth McFarlane, we have developed and continue to develop innovative techniques.
The goal of the center in providing teaching is to really develop the clinical caregivers of tomorrow, and that is why we've always encouraged people to come to the center to learn, and also the people that work here have gone out to teach worldwide and spread the word of the Hand and Upper Limb Center to advance care.
There are many patient stories that resonate. Some are dramatic, such as amputations that have been replanted and allows the patient to carry on with life. Others seem very minor in terms of what you've done for the patient, but make a dramatic difference in their lives.
Starting a lawnmower, a pull lawnmower. Of course, as stubborn as I am, I repeatedly did the same motions and therefore tearing my rotator cuff. I'm very happy to have had such a wonderful institute, so close to home. Met some beautiful people on the way, and I feel like I'm healed. We should be very thankful and very proud that we have this level of care in our own backyard.
I'm an avid golfer, and it's had a detrimental effect on my golf game. At least that's my excuse. I thought I'd be afraid of coming in to have my shoulder replaced, but they just exude that confidence. I wasn't worried at all. I knew I was in good hands. Pain's gone, life will be very good.
And when he said that he could give me a new wrist, it was unbelievable. Just the relief. I have much more freedom now. I can go grocery shopping, I can tend my garden, and I can go for a long drive. You have no idea how happy I am and how thrilled, and what a change this is going to make in my life.
The cartilage disappeared in both of my thumbs, which made a lot of things difficult, including playing the piano. Well, I don't think I could find any better care anywhere. Thanks for putting music back in my life.
The research activities at the center are truly unique. I can count on one hand a number of centers across the world that do what we do here. One of the most exciting advances has been the development of the Evolve radial head implant to replace part of the elbow. It is now the #1 selling implant system in the world. Another exciting advance has been the development of better repair techniques for torn ligaments, and this has certainly had an impact on patient care and outcomes. The Roth McFarlane is the only center that is currently exploring robots to place implants in a minimally invasive fashion into the shoulder, the elbow, and the wrist. Our research is setting standards for the care and treatment of the upper limb on the international stage.
Thank you, Drs. Roth and McFarlane, two renowned and respected surgeons.
Because they had vision, we have a world-class centre for care and treatment.
that continually pushes the boundaries of surgical innovation and raises the bar on standards of care and patient outcomes.
For a future without pain.
where we don't just perform complex procedures and advanced therapies, we refine, share, and teach them to colleagues working around the world.
For a future with independence.
Where change is always an opportunity and pioneering research is advanced in state-of-the-art labs.
For a future of knowing the best care in the world is right here in our backyard.